Hey everybody, this is Dr. Dustin Hendrix coming at you. We're going to be looking at a video here today called Should I Be Worried About My Imaging Results? This is really interesting. This is actually why I went on this path of trying to understand a little bit deeper into what they call the biopsychosocial of chronic pain. Basically looking at how, tissue isn't always the issue. And remember, always take this into context of what we've been saying. I look at it like this. You have people who have twisted their ankle last week. They come in, they need care for the ankle. Then you have some people, they twisted their ankle. It's been 4 to 6 months. It's never been treated. They have the ankle issue, but now they also have the nervous system becoming sensitive. And then you have people who twisted their ankle, 3-5 years ago. It's really hard to define chronic pain in these perfect numbers. But once you've had that initial 2-month period on a grade 1 or 2 ankle strain and it hasn't gotten better and it's still there, then it's set in the nervous system. So how I started to understand this was I was very progressive coming out, just looking at, more tissue issues and orthopedic and medical chiropractic. But I started noticing that didn't always correlate. And what I meant by that is the study that I saw where we had disc bulges in people who had never had pain. And that's what started me on this path. And so we're going to talk about that a little bit more. So this module right here actually will break down areas depending on where your pain is at. So neck findings. And you've got your title of your research paper here, and then you can also see the authors as well. So if you want to cross-reference these, you're more than welcome to. They'll come up on PubMed. I think you can even type them in on Google or Google Scholar and they'll come up as well. So you notice asymptomatic is used a lot. That just means people who had never had pain in their life. They didn't have any symptoms whatsoever. So in this first study, they were comparing people who had a disc herniation with pain versus people who had never had pain. The interesting thing was there was a higher rate of degeneration in cervical disc, so it was almost 100%. But the fascinating thing was people who did not have a disc bulge was 9 out of 10, so it was 90%. That's still a pretty high percentage there. So, and remember when we're talking about disc bulges, I got my spine here. So we're talking about the cushion that sits in between the bones. I tell people to think about it like the jelly donut. And a lot of times what will happen is from degeneration, an acute type of injury, you'll actually get a portion of the disc that'll push back on the nervous system. And it's not this perfect pinch. It deals more with pressure versus looking at it it's just a complete compression type thing. There is complete compressions, but obviously those are in the ER and they're not in our office. We're seeing stuff like loss of control of bowel and bladder, can't hold your foot up, no motor control, things like that. So, we do have lines on this stuff. Let's go into here. So 1,200 people who had not had pain. So you'll notice in this study, they actually say the relative high prevalence of abnormal MRI findings in the cervical spine in people who had not had pain emphasizes the danger of predicting operative decisions on diagnostic tests. So this is what's going on here. So we're starting to figure out that if you prematurely image people, it's almost 100% guaranteed that you're going to find something on them. But just because there's something on them doesn't mean that it actually clinically correlates. It can play into it, absolutely. And you also have to look at, the levels and stuff like that. They're starting to look at it more of like a cluster. And so what I mean by that is, if one of these things is there, there's a little bit of likelihood. But if 2 of these things are, the likelihood goes up, and then 3 and 4 and 5. So they're starting to look at it more in clusters. You have a little higher percentage of it being there, but the interesting thing that we want to take away from it is just because you have the stuff doesn't mean it's a guarantee that you're going to get stuck in the cycle. This is also why you're noticing that shift from chiropractors who image you immediately versus chiropractors who want to do a conservative trial. And this has been going on with orthopedists and medical doctors and even physical therapists, and chiropractic is catching up that our first line isn't just shooting and imaging unless there's something like a trauma or a fracture or a tumor, something more ominous that we're suspecting. If it's, fitting within the lines of our wheelhouse, then it's absolutely something that we want to try conservatively before we just jump the gun on it. And it's because you can give somebody a premature diagnosis of oh, I have osteoarthritis. Well, everybody has some form of osteoarthritis. I have osteoarthritis. So how do we know if it's clinically relevant or not? And that's where going through the process of this conservative trial is so important. This was really fascinating. They did a study on demolition derby drivers. And this is really fascinating for me because we have treated a lot of auto type cases. And your auto type cases, they have a higher incidence of getting stuck in chronic pain. And you have to remember there's a lot going on with there that we talked about. The environment, it's very traumatic. You've been hit by a car, you're in a fight or flight, you're really scared, your body's really settled. So your nervous system's a little more sensitive. Now the other fascinating thing is, because of the way that the auto systems are set up in some states in America, law firms make a lot of money by playing up into these. And we're not saying that you've been in an accident, that there's not some type of tissue issues that need to be resolved. Remember, we got to take everything in context. But what we are saying is, because of the environment, because of what you've been telling, how bad everything is and how much everything is to play up the case and get more money, it sets this nervous system off and it makes it harder to recover. There's a study that I didn't put in here on a province in Canada, Saskatchewan. They actually moved away from these like PI type claims, and they saw just these fascinating drops in the rates of how long it took people to recover, and even how like severe the symptoms were in whiplash. It's really fascinating. I didn't put that one here, but if anybody's interested, let me know. Okay, so we also have this in the low back as well. This was really fascinating because we have asymptomatic junior tennis players, and these are elite level players. And you can kind of look at like the setup here, but the interesting thing is you'll see facet joint arthropathy, and this is why I have this guy right here. So the facet joints, if you look into here, are basically the joints in the back right here, okay? And so when you look at an actual spinal joint, it's made up of a facet joint and the disc as well, okay? So the interesting thing though, they saw everything, even like pars and ticularis abnormalities. Now let me explain what that is. So the pars is in the lumbar. So if you can see this portion right here, the bone, and so think about that portion of the bone actually being eroded or not there, and then you're actually starting to see that anterior slippage. That's when they will say spondylolisthesis. It's just a fancy word for saying your vertebrae is starting to move forward. You could have an anterior or a retro. The vertebrae may move backwards, but typically we see them anteriorly. And then they're graded on your Myers grading, 1 through 5 type stuff. Yeah, it's fascinating. Okay, so we have another one here, systemic literature review. And so you'll notice what we're pulling here, these aren't like a case report, like we had one person. We're pulling massive studies here. So when you look at your hierarchy of evidence, you want to be looking more at your systemic reviews and your meta-analysis. And then, you can also look at your randomized controlled trials, but those systemic reviews and meta-analysis are the higher ends. So here we go again, systemic literature review, spinal degeneration, asymptomatic populations. This one had 3,110 people pulled. The interesting thing is degeneration and asymptomatic was 37% of 20-year-olds. So almost 40% of 20-year-olds, 4 out of 10 people who are 20 already have degeneration, but they've never had pain. And now here's the amazing thing. When you get to 80 years old, it's at 96%, almost 100%. So this is why we're trying to start letting y'all know, like, everybody has a little bit of wear and tear of some kind of finding, but it doesn't clinically mean that you're going to be stuck in pain till you die. And they put it all out here. Imaging findings of spine are present in high proportions of people without pain. Many imaging-based degeneration features are likely part of the normal aging process. Another fascinating thing here is the incidence of spontaneous reabsorption of disc bulges. This is one that's not you. This is a meta-analysis too, so yeah. So basically this kind of blew our minds. The thought that you could have a disc bulge and your body would actually naturally clean it up. And the fascinating thing, and I trick my interns with this one all the time, I ask them, would a disc bulge that was larger or smaller have a higher likelihood of reabsorbing? And, it's counterintuitive, but it's actually the larger one, because what they think is it causes a bigger immune response. This is why we're so big on, peace and love versus, insects. And, now the CBC is like the news outlets and stuff like that, they've been posting articles about the higher correlation of people taking NSAIDs being linked to low back pain. But it's because it's stopping the body's natural response. So the body can actually go in there, and it has these cells called macrophages, depending on who you ask. I have a little bit of Texas twang there. But there's actually specific cells that will actually go in there and eat it up. And if you think we're just like stuck on the spine, we've got shoulders here too. Abnormal findings on MRI again, asymptomatic shoulders. This will kind of set you up a little bit. So you'll notice, the younger they are, there are some findings, but the older we get, we have more of them. So the overall prevalence of tears in all age groups was 34%. So you have people who have never had pain, 34% of them had a tear in the rotator cuff. The real interesting thing was, there was 15% had a full thickness tear, so like a complete tear of a rotator cuff muscle. And then, your other percentage was the partial tears. And then you can see, once again, like we're saying, 54% of the 46 individuals who were more than 60-year-olds had a tear. And so basically what they're saying is, there's a higher prevalence rate, but we've seen it now where we have full and partial rotator cuff tears and never had pain. Here's another one. Our results indicate that rotator cuff lesions are a natural correlate of aging and often present with no clinical symptoms. Treatment should be focused on clinical findings, not on the results of imaging. Hips. Yes, this was really interesting. And once again, you had asymptomatic participants. They had labral tears, were identified in 69%. So when you look at a labral tear, so this is your hip right here. This is the femur going up. So the labrum actually sits in this socket or this groove, and it actually acts as like a cushion to basically cause more depth to the socket to give it a little bit of stability. So that's why they call these an axial joint, because it can move in different planes. The intelligent design of our bodies, like how it was either designed or evolved depending on what you believe upon. It's just fascinating that we have a labral inside there. But that's what they're talking about when they talk about the labral effects. And you see 70% had a labral defect, 69. Chondral defects, ligament tears. Kind of crazy, right? This was one that we found 230 knees were imaged. There was an abnormality in 97% of the knees. Sorry, I'm not trying to laugh. It's just the response. It's just so fascinating because it's completely flipped on our heads what we thought. And you'll even see that there was meniscal tears. 30% of the knees had a meniscus tear. And previously, we thought, meniscus, surgical, take it out. But yeah. And then we have a little bit here of basically, what we're doing with the pain neuroscience education, what are the resources, what are systemic reviews, and why we're doing what we're doing here. Guys, so it's really fascinating. The main takeaway from this is to kind of understand that we're not saying that tissues don't cause issues, but what we're saying is that we have a large percentage of the population that has tissue issues and they have no pain. So if we can actually get you to do the right rehab that doesn't make your nervous system more flared up, and you got to remember, take this into context too, but you could have somebody that had their leg amputated and they've never had pain. They've had their leg amputated and they can have pain. So, always take these into clinical correlations. All right, guys, thanks for joining us on this one. We look forward to seeing you in the future. Bye now.